Computer G, are we live now?
Yes, ma'am, we are live.
Why? It is still not 7:30. Good evening, all the participants. Welcome to Fever Foundation first ever Fever Quiz program. And thanks for joining in. And today it's an exciting session. The Eastern Zone will be participating. Can I have the next slide, please? Next slide, please. Yeah. To conduct this program, we have very eminent doctors with us, and we have the judge with us, Dr. A. Muruganathan sir. It is my proud privilege to introduce him, although he doesn't require any introduction. You know him on several academic events. He is known to all of us. Just very quickly, sir is FRCP, double FRCP, FACP, FPCP, and he has an extremely good academic he's ex emeritus professor from Tamil Nadu MGR University, immediate past governor of American College of Physicians, dean of Indian College of Physicians, and president of Hypertension Society up to 2016, past president of IAP and president of Tamil Nadu IMA, and several professional organizations. He's been the editor of Adult Immunization, Progress in Medicine, Medicine Update, and Manual. He had several awards and accreditation, including he is a recipient of prestigious BC Roy Award, and he has been given the excellent award from the other countries, including ACP Japan, and many of he has received the Lifetime Achievement Hypertension and Tamil Nadu government, several of them. Sir, it's our privilege and pleasure to have you as your judge, sir. Welcome to this program. May I now request you to kindly take over and conduct the proceedings. Over to you, sir. Thank you very much.
Thank you, Dr. Manjula. Thank you, Jairaj, and thank you, Fever Foundation. Can I have the slide, please? I'm very pleased to be here to conduct the program. It's a really interesting quiz program. It's always a pleasure and thrill to participate in any quiz program and attempt, at least if not win the quiz program, at least attempting itself is a very interesting and really thrilling experience. Okay, we have some rules and regulations for this national quiz program. The quiz is for only postgraduate students. The quiz consists of multiple choice questions. The option to be selected by clicking on the button on the text panel. The video display with options will be only for representation purpose only. The participants are advised not to leave the platform and enter the YouTube channel. Once submitted, it will not be possible to revert it. No negative marks. The winner will be the maximum fast right answers. If there is a tie, the tiebreaker round with 3 questions will be done to decide the winner. It is advisable to use the laptops or desktops. Friends, these are the normal general rules and regulation. In case of any tie, of course, we have the 2 eminent referees on the field.
Next slide.
Yeah, advice again, rules continue. Advised to participate from a place with good internet connectivity only. If found to be any type of foul play, will be automatically disqualified. Should not use mobile phone for getting answers from any colleagues sitting nearby. Fever Foundation is not responsible for any form of technical error over net connectivity. Participation in the quiz implies that the participation accept the integrity of these rules. The participants who have given incomplete or inaccurate personal and contact details will be disqualified. Non-compliance with the rules results in the automatic cancellation of the participation in the quiz and of the candidacy for the prize. The first and second winners as a team from each zone will enter the national level quiz at FEPCON 2022, November 2022. Quiz masters and judges' decisions will be final. So I hope everybody is clear with the rules and regulations. Now what we are going to do, I'm going to introduce two eminent professors who will be the referee, and then we'll also play 3 trial questions where you will know what are the problems, and you can ask always ask them. And if you have any doubt, we'll clarify before we go to the main quiz program. So can I have the introduction of the Dr. Ramesh Agarwal, please? Suresh Kumar. I think Suresh Kumar's slide has come, Manjula. Ghanshyam. Yes. I think, Suresh Kumar and Ghanshyam are again judges, sitting back.
Ghanshyam Pandey sir is also there.
Yeah. So I will introduce first Ramesh and the Subbalakshmi. Of course, Ghanshyam Pandey and Suresh also I will introduce. They are on the backstage. But Ramesh and Subha will be in the field. They are the field umpires. And Ghanshyam and Suresh will be the third umpire or sitting in the back. So first, Ramesh Agarwal is a professor of medicine, Lady Hardinge Medical College and Association Hospital, New Delhi, recipient of Srimati Pawan Kumariji Jain Oration Award for outstanding work in the field of internal medicine, chaired sessions and delivered lectures in various national level conferences, Diabicon, API, DSC, Epicon annual conferences, served on the board of management of Delhi Diabetic Forum, has over 70 publications in the national international journals. So he is going to be one of our referees. Now I have the pleasure of introducing Professor Subbalakshmi. Can I have the slide, please? Introductory. Yeah. Subbalakshmi Margekar is the professor, Department of Medicine, again, Lady Harrington Medical College, New Delhi, fellow of Indian Medical College of Physicians, fellow of Association of Clinical Medicine, coordinator in Chief Thalassemia Adult Daycare Center and Thalassemia Transitional Care Clinic, recipient of Dr. J.C. Patel and B.C. Mehta Award in Epicon 2014, faculty in Epicon 2015, 2018, 2019, and 2020, faculty and organizing team members in APA, DSC, CME, faculty and organizing team member in Diabicon 2015 to 2020, delivered lectures in Epicon, Diabicon, and various other conferences, participated in several multicentric international clinical trials, guided 12 PG theses, have several publications in journals and books, APA Textbook Medicine and Medicine Update. So these are our referees, very eminent and very qualified, eminent professors. And then backstage there are two again judges. Can I have the introduction of the Ghanshyam? Yes, Ghanshyam. First we'll have Ghanshyam is a professor of medicine, again Lady Hardinge Medical College, New Delhi, rheumatology and medical ICU in charge, Joint Secretary of Indian College of Physicians, the API Delhi chapter, executive member of Delhi Rheumatology Association, associate editor of API Textbook of Medicine 9th, 10th, and 11th edition, published 100 indexed and non-indexed articles in reputed journals, co-edited books, Pearls for Scientific Paper Writing, Research Methodology and Ethics in Clinical Research under Research Foundation, Medicine MD, NB postgraduate teacher and examiner of Delhi IIMS, Rajasthan. So I have the pleasure of introducing Dr. Ghanshyam. One more judge is there. He's always available. Dr. Suresh Kumar. He's an American certified tropical medicine specialist, fellowship in HIV, adjunct professor, and co-founder of Best of IDs, senior consultant of infectious disease physician, Apollo Hospital, Chennai, advisory board member, Fever Foundation. He's also in the backstage. He'll soon join the judges panel. Now it's up to Ramesh and Subha to conduct the program. As I said, there'll be 3 questions trial run, and I request all of you, my brothers and sisters, to carefully watch those 3 questions and try to answer. There is no mark for these 3 questions, but whatever doubt you have in between, you can always ask Ramesh before you go for the main quiz program. So with this, I now request Professor Ramesh to take over and start conducting. I think Hardik Chandra, are you ready to post questions now?
Yes, sir.
Yes, please. Computer ji. Yes.
Thanks, Dr. Muruganathan, sir, for your nice introduction, your kind words. And thanks to the Fever Foundation for organizing such a quiz, which will truly be a very pleasant experience for all the postgraduates who are joining this quiz. So let us begin with the quiz. So can we have the demo question first? So the first question is on your screen. Who is the director of Sholay movie? Minded, this is a demo question. Your choice 1, choice A is Ramesh Sippy, choice B, Ayan Mukherjee, choice C, Rajkumar Hirani, and the choice D is Yash Chopra. And your time starts now. And the time is up. One of the best movie made ever in the Indian Bollywood cinema, Sholay. And probably everyone is aware about this movie. And it will be a great experience and pleasure to see who all of you who already have answered this question. So please note, may I have the right answer, Computer Ji? So it is Ramesh Sippy. So let us see how many of you have marked it correct and how many of you have really done it fast. So 100%. So that's great. So 100% of the students have marked. So I think you all are very well versed in the Bollywood of Indian cinema. So I think that first question ran very well, ma'am. So let us have the second question. Computer Ji. So the second question is, guess the name of Tollywood actor. Choice A, Naga Chaitanya. Choice B, Akhil Akineni. Choice C, Ram Charan. Choice D, Allu Arjun. And your time starts now. So the time is over. So with the Bollywood and the Tollywood, now let's see how many of you have marked this as the right answer. Computer Ji, can I have the right answer? So Akhil Akineni. So probably that was not very difficult. Let us see how many of you have marked it correct and fast. Can we have the right and the fast options, Computer Ji? So probably the computer is still working.
What is your guess, sir? How many would have answered correctly?
Yeah, so it is. Oh, so there is some confusion in the Tollywood. So probably 62% of them have marked right. Some have said the choice A, some have choice D, and a few have also marked choice C. Right. So can we move to the third question, Computer Ji? So the question is in front of your screen. What is the full form of IMDb? Choice A, is it Internet Movie Database? Choice B, is it Indian Movie Database? C, is it Internet Move Database? D, is it Indian Mass Database? So the chime starts now. So even I think the computer will start questioning itself. Yeah, so the time is over, and I think there will be many variation in the choices, which at least I don't have an answer to this. IMDb, Internet Movie Database, Indian Movie Database, Internet Move Database, and the Indian Mass Database. So a very closely knit options. Can we have the right answer? So this Internet Movie Database, IMDb.
So what is your guess, sir? What percentage of people would have answered it right?
I think, ma'am, it must be around, say, 50 or 60%, not more than that, who could have answered this question. Otherwise, if they are very good, Oh, it is 77% knows about the answer. So that means my general knowledge is a little poor as far as the non
Moving.
PEPCON quiz is there. Yeah. Yes, ma'am.
Moving.
Yeah. So probably the trial run very well. I don't think so there have been any problem in this. So with your permission, sir, can we start the quiz?
I think if the audience, if the candidates have any question, they can raise it in the chat box. For another 1 minute,
No,
you
sir.
can just see there is any
Sir,
questions from chat
sorry,
box?
sir. Sir, chat box will not be accessible to them during the
Okay.
quiz time.
Okay,
sir.
okay, okay. No. Okay. If they have any doubt, how do they express? If they have any questions or anything?
No, we have been sending them the communication, sir, about
Okay.
these rules
I
and
think
regulations.
I think these three dry run or trial runs would have given you a practice. So you should be very quick. And once you decide, you cannot change. And that's all. I think everything is set. Now, Ramesh, you can go ahead. Subha, the podium and the platform is yours now.
Yes, sir. So I wish all the East Zone very, very good luck for both this answering the quiz and to be very fast. So as already Dr. Mugunathan sir has told the participants that the winner will be one who answers the questions correctly, and your response, your reflex has to be very fast. So participants, let us start the quiz. So computer ji, can I have question number 1? So the first question is, what is the circadian rhythm of temperature? Choice A, daily variation of 1 degree centigrade with high morning temperature. Choice B, daily variation of 0.5 degree centigrade with high evening temperature. Choice C, no circadian rhythm of temperature occurs. Choice D, no circadian rhythm of temperature occurs. And your time starts now. Yeah. So I think the basic medicine starts from temperature, and what is the classic learning in the medicine wards and the book says that there is a variation in the temperature of human body, which varies from morning to evening. So can we have the correct answer first? Yeah. So the correct answer is there is a circadian variation of the temperature in the morning and the evening, which varies from 0.5 degree centigrade. The normal morning temperature is about 37.2 degrees centigrade, and the evening temperature is 37.7 degrees centigrade. So this is the basic knowledge, and by this we decide whether the patient is having fever or not. And one should not forget this when assessing or diagnosing fever. So that lays the core foundation of definition of fever. So can we have the responses breakup? How many have answered the correct answer? Computer ji, are we ready with the breakage of the answers, the options?
So that reminds
think,
me,
yeah.
once it is working,
Yeah.
computer, if you remember, sir, 2017, the Nobel Prize in Physiology, the 3 researchers got it. Their discovery was on circadian rhythm. Dr. Jeffrey,
Yes.
Michael Rosback, and Michael Young. So that I think, if you agree with me, the first molecular mechanism of circadian rhythm, then it became very brought the attention of all scientists, health professionals to all this. Yes, sir. Over to you, sir.
Yeah, actually, the circadian rhythm is now true for many other physiological mechanisms also. Like it is not only now for the fever, many hormonal changes, as you all know, many diseases which have got their morning and evening variation. So it is an important topic for the postgraduates probably, and many of them know about this, and 73% of the students have marked it correct. And probably the others who had some confusions about the correct option. So one should go back and always be perfect in definitions of fever. So with this, can we move to the next question, Computer Ji?
Sir, please find out who
Yeah.
is the answer, the right person who answered it fast.
Okay, right. So the winner of this first question who has answered it rightly and the fastest one is Dr. Satyadeep Sarkar. And the time taken to answer this question was 4 seconds. Congratulations, Dr. Satyadeep Sarkar. Congratulations. Keep it up. Yeah. So can we have the next question, Computer Ji? So the next question is on your screen. What is hyperpyrexia? Choice number A, is it fever which is more than 40.0 degrees centigrade? Choice number B, is it fever of more than 40.5 degrees centigrade? C, it is fever of more than 41.0 degrees centigrade? Or D, is it fever of more than 41.5 degrees centigrade? And your time starts now. Time is over. Again, one of the very, very important topics, hyperpyrexia, hyperthermia. As a postgraduate, once you are aware of the definitions of fever, the next thing which comes is what is extremes of temperature. And the definition we must remember, because this is how you will be able to distinguish a normal fever from a hyperpyrexia. And as a postgraduate, we must also learn what is the difference between hyperpyrexia and hyperthermia. So first of all, can we have the correct answer? So the correct answer is on your screen, fever of more than 41.5 degrees centigrade. So this is the definition which is given in your Harrison Principles of Harrison's of Medicine, and we must learn it. So can we have the breakup?
Yeah.
So
Even
treating
yeah, sir.
hyperpyrexia is yes, ma'am.
Go ahead, sir. Please go ahead, sir.
Yeah, so treating hyperpyrexia is actually different than what we do in hyperthermia. So the basic mechanism, which is the difference between hyperpyrexia and hyperthermia, is that the hypothalamus loses its control in hyperthermia. So if you in the emergency, if a patient comes to you with a high grade of temperature, say more than given temperatures 41 or 41.5 degrees centigrade. So, and if you start pumping paracetamol, in these patients, probably hyperpyrexia will respond, but certainly hyperthermia will not respond. And there are many different causes for both hyperpyrexia and hyperthermia. As a student, you should learn them so that we are better able to manage the patients in the emergency. So, yes, ma'am. So, are we ready with the breakdown of this hyperpyrexia question?
Yes.
Okay, so many of us are aware of the definition. It is around 63% of the students have answered it rightly. Still, there is some confusion, like 19%, 12%, 5%, roughly say 35% of the students are not clear for the definition. So anyway, this is a learning platform. Fever Foundation has always been helping the students by organizing such quizzes and such academic programs, so that this becomes more of a learning and a challenging activity for all of us. So can we have the winner of this question? Oh, great, Dr. Yukti Bansal. So congratulations, Dr. Yukti Bansal. And it is very heartening to see that you have been able to answer this question in around 3 seconds only. So congratulations. Yeah. So the next question, Computer Ji. Can we have the next question? Again, the syndrome of fever of unknown origin, FUO or PUO, was defined by Petersdorf and Beeson as the following: a temperature greater than 38.3 degrees centigrade or 101 degree Fahrenheit on several occasions. More than 3 weeks duration of illness. Third, failure to reach a diagnosis despite 1 week of inpatient investigations. So your question is, which of the above statement is or are correct? Choice A, only the first one is correct. Choice B, both the first and the second one, both the first and the third one are correct. Choice number C, both the first and the second is correct. Choice number D, all the statements given are correct. Your time starts now. So the time is over. Again, FUO, like any other undifferentiated diagnosis in the medicine, it creates a lot of confusion and keeps the physician and the treating doctors on toes. The definitions have been revised over the time for this FUO as more and more evidence comes in. So let us the correct answer before we go into any more discussions. Computer ji, can we have the right answer for this question? So the answer is that all the statements given are correct. So the PUO, it says a temperature of more than 38.3 degrees centigrade on several occasions with a more than 3 weeks duration of illness. And the definitions, of course, this is the older one, the newer definitions, it says that in immunocompromised, if the patient is immunocompromised, the definition has got a different meaning. And if the patient is, depending on the areas in which they stay, the investigations can vary from hemogram, LFT, KFTs, and other known infectious causes. They have to be ruled out before coming to a final diagnosis of PUO. So again, a very important topic in medicine, which a physician should know about both the how to diagnose. So can we have the breakup of how many students have really given the answer? So this is again a very good sign for all the students. The 62% of you are aware of the definition of PUO or FUO. Again, I think there is some confusion, like around again 35% of the students have some doubts about the definitions. Probably they are confused whether the patient should be admitted and investigated or not. So again, the important topic, I will say that we must read about this topic. And the winner of this question is Dr. Shani Harpo Vikram. Okay, congratulations, Dr. Shani Harpo Vikram. And you have taken around 4 seconds to answer this question. Many, many congratulations from Fever Foundation.
Sir,
Okay,
see,
can we have
people
the
are
next? Yes,
answering so fast. 4 seconds
Yes,
only.
ma'am.
They've all come well prepared. Huh?
Well prepared, ma'am. Yes,
Right,
ma'am.
yeah.
Yeah, and it's
Okay, sir. Please
and
go.
yeah, ma'am. And another good thing is that such type of questions and quizzes probably act as a challenging option for the other students. Like if there is some confusion, they're able to learn from this particular quiz. Yes, ma'am. So can we have the next question?
Okay. Sir.
The Q-SOFA score, quick sequential organ failure assessment. It includes all of the following criteria, except A, respiratory rate more than 22 per minute, B, altered mental status in which GCS is less than 15, C, creatinine more than 1.2 milligram per deciliter, D, systolic blood pressure less than 100 millimeters of mercury. Your time starts now. So there is end of the time now. Again, Q-SOFA score is now one of those quick assessment tool which is used by the physicians and the emergency people in the emergency where they can really decide about whether to admit the patient and what will the prognosis of the patient. So can we have the correct answer to this question? So very close options, like if someone has not read the QSOFA score, probably it will be difficult, as creatinine somewhat becomes an inherent part of many of the scores. So, but incidentally, or maybe by research, that they have found that the QSOFA score, creatinine will not be that helpful as compared to the respiratory rate of more than 22 per minute, or someone who has an altered mental status of GCS less than 15, and someone who comes with hypotension. So 2 out of these 3 scores of these 3 criteria, if positive in a patient, so the chances of mortality in the ICU, it increases. So probably that's the importance of learning QSOFA score. So
And
can
also
we have the breakup of?
probably,
Yeah.
yes, sir. Maybe just
Yes,
sorry, sir. A referral of sepsis patient also at this level, primary care, this will be useful, sir. Otherwise, it
Yes.
gets delayed due to any assessment tool. Probably they can use this, and we have all these now apps also available where quickly they can calculate also to improve the patient's outcome, and
Yes,
referral
yes.
also becomes little faster, sir.
Yeah, so basically every scoring system, whether for pancreatitis or whether for assessment of sepsis patient, it adds to acts as an armamentarium for the physician to decide quickly. Like Madam said, that even if you are working in, say, a primary health center at the remotest area, so just 3 clinical parameters will help you to decide whether this patient has to be treated there at your center, or it has to be shifted somewhere, or it has to be dealt with an emergency care. So these are actually the very strong points of having these scores and assessing them at the bedside. Yeah. So can we have the breakup of the correct answers? Oh, so 90% of the students are aware of this QSOFA score, and it is very, very good indicator that probably you people might be reading it and probably using it also in your emergency. Some of them who had some confusions, probably, as I said, in some, like adding to the creatinine or missing like a blood pressure. So probably this question might have helped them to remember the correct sequence of QSOFA score. So that's very nice. So who is the winner of this question? So it must be a close competition. So Dr. Tanvi Yusuf, so many, many congratulations to you that you have been able to answer this question very quickly and correctly in about 4 seconds. So we congratulate you and wish you all the best. So the next question. Now, a 70-year-old male who was diagnosed with COVID-19 infection, he complains of sudden loss of vision in the right eye. The fundus examination shows the following picture. What is your diagnosis? Is it endophthalmitis? B, is it central retinal artery occlusion? C, is it optic neuritis? D, is it retinitis? And your time starts now. So the time is over. COVID-19 actually has caused n number of clinical manifestations, and it has perplexed everyone from patients to the treating doctors. And probably the ophthalmological manifestations of COVID-19, they were equally disturbing for both the patient and their doctors. So let us have the correct answer first. Computer ji, correct answer dikhaiye. So the correct answer is central retinal artery occlusion. Now this disease itself, as the name suggests, probably is a very dreadful disease in the sense that it may cause sudden loss of vision for the patient. and COVID-19 being an inflammatory disorders causing thrombosis and thromboembolism throughout the body has caused this disease, central retinal artery occlusion. Now, central retinal artery occlusion can be caused by many other inflammatory disorders like SLE or a cholesterol emboli, diseases like diabetes, hypertension, or other inflammatory disorders. They may all cause central retinal artery occlusion, and COVID-19 has joined this list. So if you are ready with the breakup of how many have really attempted this question. So again, the correct answer has been 80% of the students. So good to learn, but again, it was, I think, something which tells us that routinely looking for the fundus examination in every patient as a postgraduate of medicine, that will help you in finding and in localizing the lesion in the eyes. So probably this art we should not lose, and fundus should be examined in every patient. And who is the winner of this question? Yes, ma'am.
I just wanted to ask, your center was a COVID center. Did you find any case report of such kind in your hospital, sir?
Yes, ma'am. There are a lot many cases of thrombosis and thromboembolism, and of course, few case reports were there. I will not say that there is an exact database, but yes, 1 or 2 reports they had reported of the artery occlusion. But again, the patient had been diabetes and along with COVID-19, so the exact etiology cannot be labeled as 1-to-1, but of course, as an inflammatory cause, which is exaggerated in diabetes. So probably that was one of the reasons for this cause, ma'am.
Okay, thank you, sir.
Yes. So who is the winner of this question? Dr. King Shu Kar. Okay. So I think a medicine postgraduate answering this question is less than 3 seconds. So many congratulations, Dr. King Shu Kar. It seems that you have been reading the subject very well, and congratulations from our side. So can we have the next question? So what is the cutoff according to MASCC to classify a febrile neutropenia as high risk or low risk? A 30, B 21, C 10, and D 15. Your time starts now. So the time is over. The question is not very simple as the previous questions, but it has its relevance and importance. The febrile neutropenia is one situation where again it is difficult to bring it up if the patient is having a persistent neutropenia despite using certain granulocyte stimulating factors. A score has been mentioned in the literature, a multinational association of supportive care in cancer, which we highlights as MASCC score, which defines and categorizes as a patient as a high risk or low risk. So first, let us have the correct answer. What is the correct answer, Computer G? So a 21, a score of 21, and this score includes many other factors like COPD, blood pressure, depending on whether the tumor you are dealing is a solid tumor, the age, the fever. So presence of 6 or 7 factors define this score. And they say if the score is more than 21, then there is a very low risk of patient doing bad. But if a score of say less than 15, then the patient's health condition will deteriorate very rapidly. So can we have a look at how many students were able to attempt this question? So again, 47% of the students were actually aware of this score. Of course, this was a tricky and a difficult question, but again, it can be an eye opener for many of us who are not aware of this score. And certainly the topic is very important, febrile neutropenia, as far as the patients in the ICUs and the emergencies are concerned. So can we have the winner of this question? So Dr. Madhurima Datta. So many congratulations, Dr. Madhurima Datta. So probably you must have any case of febrile neutropenia, or you must be reading very strongly that you have been able to answer this question in about 4 seconds. Congratulations from all of us from the Fever Foundation. Yeah. Can we have the next question? The accepted threshold for bacteriuria to meet definition of COTI, which is catheter associated UTI, is it 10 to the power 3 CFU per ml of urine? B, is it 10 to the power 4 CFU per ml of urine? C, is it 10 to the power 5 CFU per ml of urine? Or D, is it 10 to the power 6 CFU per ml of urine? And your time starts now. So the time is over. A very important topic, UTI, urinary tract infection, which every physician observes, treats, diagnoses in their day-to-day practice. And it is well known that if you are not able to find or localize anything in the body, then just do a simple urine examination. Patient may be asymptomatic for UTIs, but they may be shedding a lot of bacteria in that. The count to tell in a routine patient and label that as UTI is different from a patient who has been catheterized. So what is the correct answer, computer ji? So the correct answer is choice A, 10 to the power 3 colony forming units per ml of urine. And if you do a routine microscopy in patients where they are not catheterized, the ratio is 10 to the power 5, and patients who are catheterized, this decreased to 10 to the power 3 CFU per ml of urine. As a resident or physician, we must know how to collect the urine in both patients who are catheterized and in patients who are not catheterized, because everything will depend on your way of collection of the urine sample. So how many of the have answered the question correctly, computer ji? So 52% of the patients have not answered it correctly. 29% of the patients of the students have answered it correctly. So there is some confusion, it seems. So I think this topic can be revised if there is some confusion which is persisting. So we can note it down, ma'am, Dr. Manjula ma'am, so that in our coming for conference, it seems that the students have got a little confusion about the UTI and the catheter associated UTI and probably complicated UTI and a non-complicated UTI and UTI in men, which is really a common topic and an important topic in medicine. Anyway, who is the lucky winner for this particular question? Computer ji, Dr. Ritika Das. Dr. Ritika Das Mohapatra. So the time taken to answer, she took a little, maybe a second more than the previous questions. So it seems to be a tricky question. So congratulations, Dr. Ritik Das, for answering this question correctly. The next question, computer ji. So the KL grading system is used for rheumatoid arthritis, gout, osteoarthritis, adult onset Still's disease. Your time starts now. Time is over. And probably again, I do not think that many of you would have been able to answer this question, but it doesn't matter, as again, this will be a learning experience for most of you who have not been able to answer. And so let us have the correct answer first. So osteoarthritis, again, osteoarthritis is one of the common diseases in the medicine, and many of these diseases are confused with rheumatoid arthritis, gout, and adult onset Still's disease. So they all form sort of joint disorders where the students and the physicians may have difficulty in diagnosing these diseases. A classification led by Cal Green and Lawrence. So they tried to make a grade of the osteoarthritis for better classification and treatment. And that included like hands, cervical spine, lumbar spine, hips, knees, and feet. And they graded after analyzing these 4 or 5 areas that whether the patient, depending on the x-rays and depending on the space between the joints, that whether this fits into a grade 0, grade 1, grade 2, grade 3, grade 4. So this is basically for osteoarthritis. So how many students have been able to answer this, Computer Ji? So 60% of the students. Okay. I hope the students are not Googling this because this may disqualify you. We have got certain appliances by which we can always see that probably there is no use of any means of knowing the answers on the YouTube, etc. So anyway, if 60% of the students are able to answer this question, it's very good. Who is the right candidate for who has answered this question correctly? Dr. Utsav Senapati. Congratulations, Dr. Utsav. You have really done a good job. And probably this was a difficult question. Okay. Can we have the next question, Computer Ji? So the next question is on your screen. Which of the following statement is incorrect for Japanese encephalitis? A. Japanese encephalitis is a mosquito-borne zoonotic viral disease. Japanese encephalitis is transmitted between vertebrate hosts principally by Aedes mosquito. C. Inactivated mouse brain derived vaccines, inactivated vero cells derived vaccines, live attenuated vaccines, and live recombinant vaccines are the 4 main types of Japanese encephalitis vaccines. D. Japanese encephalitis belongs to same genus as dengue, yellow virus, yellow fever, and West Nile viruses. So your time starts now, and please note this is you have to find the incorrect answer. Your time starts now. Yeah. This brings end to this question. Now again, Japanese encephalitis has been endemic in some part of the India, especially the eastern UP, where children have been suffering from this disease, and the government has been battling for quite long for bringing the episodes down. So again, very important from the tropical medicine point of view, both the vector and the virus. So let us have the correct answer first. So the correct answer, which is incorrect, is that Japanese encephalitis is transmitted between vertebrate hosts principally by Aedes mosquito. So if you have read the question correctly, the option here is that it is transmitted by Aedes mosquito. So as you all know, Aedes is a transmitting vector for diseases like dengue, yellow fever, and probably for Japanese encephalitis. You all know who is the vector, it's Culex. So can we have the breakup of how many students were able to answer this question correctly? So 41% were able to answer this correctly. So I think again, your knowledge of the subject and probably how fast you could read the question, probably that would also have mattered in this question. Certainly 0% for the first choice, that they were very sure, students were very sure that choice A was not the correct answer. There was a lot of good competition between choice B and choice D, but the right choice is B. That means Aedes is not the culprit for causing Japanese encephalitis. So let us see who is the winner of this question. Dr. Binod Singh. Okay, congratulations, Dr. Binod Singh. Probably you also took 6 seconds. Probably the length of the choices was long enough. And congratulations to you for answering this question correctly. Can we have the next question? So, Dr. Shubhalakshmi, can you please take it?
Yeah, sure. So thank you, Dr. Ramesh, and thank you, Fever Foundation, for this wonderful quiz. Moving on to the next question, as our students are doing very nicely. So a paraneoplastic cutaneous marker of internal malignancy with the hallmark finding being an abrupt eruption of multiple seborrheic keratosis. Which sign has been described here? It is triple palm sign, generalized melanosis, laser treadlet sign, or Trouser sign. Your time starts now. Okay, so it was also not a very easy question, it seems. But can we have first the correct answer and then we can discuss a bit? So we have 4 options. Okay, so laser treadlet sign. So these laser treadlet sign, these are rare neoplastic cutaneous marker, although others are also rare form of this thing. Dermatological ridges are this thing thicken in cases of triple palm sign. In generalized melanosis, it is seen as a complication of malignant melanoma. And Trouser sign, as we know, it is seen in cases of hypocalcemia. So if we are ready with the percentage of students responded correctly, Trouser sign usually we see in the wards whenever we see a case of hypocalcemia, tetany, sign of tetany. But this laser treadlet sign is a rare sign of paraneoplastic cutaneous markers. It is not very commonly seen, and it appears as abrupt eruption of multiple seborrheic keratosis. So Computer Ji, can we have the percentage of students that have corrected? Okay, so I think here also it was not so easy, but yes, students have answered it correctly, 83%, good number of students. So that is good. And who is the person who has corrected it, marked it correctly? In 4 seconds, very nice. So Niranjan Day, he has answered it correctly in 4 seconds. Congratulations, Dr. Day. And yes, now we will moving on to the next question. So RF is IgG against IgM. Option B is IgM against IgG. Option C is IgG against IgA. And option D is IgM against IgD. Your time starts now. Okay, so we have time is over. So let us discuss. These are all immunoglobulin autoantibodies regarding which it had been discussed here. And RF is rheumatoid factor. So which of the following is correct? That we have to see. So can we have the correct answer, Computer Ji? So it is IgM against IgG. It is immunoglobulin M, autoantibody against the Fc fraction of immunoglobulin G, which is seen or found in rheumatoid factor, and rest of the things are not positive or not found in rheumatoid factor. So how many of the students have answered it correctly? Let's see. Okay, so rheumatoid factor, usually we got it tested in patient with joint pain or body ache, because vague complaints can be there. But yes, specific findings like joint deformity and all can also be seen in the later stages. But yes, initially only joint pain, and many times patient present to us with vague complaints, where we can go for these investigations and we can find this investigation being positive if it is a case of rheumatoid factor in rheumatoid arthritis. So Computer Ji, can we have the percentage of students? Yes, so it is again good percentage, that is 61%. But yes, confusion is there because multiple immunoglobulin autoantibodies have been mentioned there and they are a bit confusing. So, but it is a very common topic. So ideally, we should go back to our basics and we should know what all antibodies, autoantibodies are involved in this type of common diseases. So who has answered it correctly, can we know? In a very short span of time. Very nice, excellent. In 2 seconds, Dr. Aradhya, you have done a wonderful job in 2 seconds. So I think you have read the topic very nicely. That's why it is possible for you to answer it in 2 seconds. Very nice, congratulations. Now moving to the next question. So gold standard test for enteric fever. Options are Typhi dot test, B Vidal test, C blood culture, and D is IgM dipstick test. Your time starts now. Okay. So enteric fever, every one of us has seen multiple patients, many patients of enteric fever in our PG during our post-graduation practice, and each and every emergency have 1 or 2 patients of enteric fever during the season. So very common topic, very important topic. Very important topic to be discussed, to be known, and question is also very apt. Gold standard test, because we should be knowing which is the gold standard test for this enteric fever when we are dealing with this fever very frequently. So can we have the answer, please? Computer Ji? Okay. So blood culture. Blood culture is the gold standard. It is usually not used very frequently because multiple tests are there with us. But yes, when we talk of gold standard, blood culture is gold standard test for diagnosis of enteric fever. In some studies, bone marrow aspirate culture has also found to be good, but still blood culture is the gold standard. Typhi dot, it is a serological based test, not as a gold standard. Vidal, again, it has a cross reactivity with many other infections. So it can also not be used as a gold standard. So answer is C, blood culture. Let us see how many of us has answered it correctly. Computer Ji, can we have? Yes, excellent. So 90% it is good that this common infection, the gold standard test of diagnosis for this common infection is known by 90% of us. But few still have some confusion. So this confusion should not be there. So just take a quick review of this topic. And can we have the fastest fingers first for this topic? Madhurima Datta. So excellent that it has been answered by you in 4 seconds. Very nice. Congratulations. Yeah. So moving to the next question. In severe rabies exposure, category 3, the life-saving measure is option A is wound wash, B is rabies vaccine, C is rabies immunoglobulin, and D is wound suturing. And we are here time starts now. Okay, so again, a very common disease or this thing which we encounter. And as we, a few days before only, we have some guidelines from the Supreme Court regarding the dogs bite in various part of the country. And this rabies can be caused by exposure by or bite by any other than dog also, any other canine or other than dog also. But yes, what is category 3? Category 3, first we should know what is category 3. So it is a severe form of exposure where there is a scratch or bite marks by the multiple. It can be single or it can be multiple bite marks on the patient, and that skin and mucosa is exposed. Broken skin and mucosa is exposed to the saliva of the animal. So this is category 3. And what can be given? So can we have the answer, please? Okay, so rabies immunoglobulin is the correct answer. As we have seen, it is category 3, that severe form of the disease. So here we cannot just go with wound washing or just with rabies vaccine or just with wound suturing. Wound suturing is not at all advisable in any cases, because first we need to clean the wound and everything is to be done. Then only if it is more than what is required, then only wound suturing is to be offered. So if we are ready with the percentage, we can go. Yes. Okay. So 95% have given the correct answer. That is excellent, because this is a very dreadful disease. If not timely treated or not timely tackled, can be fatal also. So, but still 5% have answered wound washing. That is also not absolutely wrong, but yes, alone wound washing will not help. So what are the, who has answered it correctly? Can we know this, Computer Ji? Okay, Kingshuk Kar. So excellent in 4 seconds. So congratulations, Dr. Kar. Now moving to the next question. NSAIDs increases the risk of CNS adverse effect when taken with which group of antibiotic? A, macrolides, B, penicillin, C, aminoglycoside, and D is quinolones. So time starts now. Your time starts now. Yeah. Okay, so time is over now. NSAID, it is a very common drug. It is over-the-counter drug used very frequently by everyone. Even we have also taken it many times, we can say, whenever it is required. So can we have the correct answer first, and then we can discuss a bit? Quinolones. So this is the correct answer. So what was the question? That it increases the CNS as adverse effect when taken with the quinolones. Actually, what happens when it is taken with quinolones, CNS effect like seizures have been observed in many patients. If the patient is already taking NSAID and because of any other infection or any other disease entity for which patient is prescribed quinolone, he or she may throw seizures as well, and CNS involvement is seen. So whenever patient is already taking NSAIDs, we should be cautious in prescribing antibiotics for any reason. So let us see how many of us has answered it correctly. Computer Ji, can we have the percentage? So it is a very important topic, because NSAID, in every prescription we have one antibiotic along with NSAID or anything else. So 50% of people have answered it as quinolones. That is good, but confusion is still in 50%. So we have to be more this thing, because NSAID are very, very, very commonly used drugs, and we should be aware of every side effect of these drugs. So Tanvi has answered it correctly. Within how much time we can see Tanvi Yusuf? In 3 seconds. Excellent. So Tanvi, congratulations for this. You have done it a good job. Moving on to the next question. Yes, all of the following antibiotics are active against gram-negative organism except A. Carbapenem, B. Amikacin, C. Cloxacillin, and D is cefoperazone sulbactam. So your time starts now. Okay, so can we have the correct answer? Okay, so cloxacillin is the correct answer. So every option other than cloxacillin is effective against gram-negative. Cloxacillin actually is a penicillin antibiotic, is a group of type of penicillin antibiotic. Rest of the others are piperacillin or third or fourth generation cephalosporin or carbapenem. These all are antibiotic which are effective against gram-negative organism other than cloxacillin. So can we have the percentage of students that have answered correctly? So these antibiotics against gram-negative, all the others can be used either in combination or alone whenever we are suspecting any gram-negative infection in any patient. But if we are giving cloxacillin, it will not be of much help because it is a penicillin group of antibiotic which is usually not given in gram-negative because it is not effective much in gram-negative organism. Computer Ji, can we have the percentage? Yes. So 76% of you have answered it correctly. Very nice. Few confusion is still there. But yes, these all are broad spectrum antibiotics. So we should be knowing the coverage as well in all the options. So, okay. And who has answered it correctly and very timely? Can we know, Computer Ji? Kaushik Karmakar. Very nice. Dr. Kaushik, congratulations. You have answered it in 4 seconds. Okay, now moving to the next question. Can we have next question, Computer Ji? Okay, so the following drugs used to treat hepatitis C are NS5A inhibitor except A. Sofosbuvir, B. Declatasavir, C. Ledipavir, and D is Velpatasavir. So your time starts now. Okay, so time have stopped clicking. So can we have the correct answer, Computer Ji? Then we can discuss a bit. Okay, so sofosbuvir is the correct answer. That means declatasavir, ledipavir, and velpatasavir. These all are NS5A inhibitor which are used in the treatment of chronic hepatitis C infection. The reversal rate or the seroconversion of hepatitis C is very good. So any of the drug when given can be checked after 3 months for the seroconversion. Now sofosbuvir. This is also nucleotide analog inhibitor of hepatitis C virus, but it is NS5B polymerase. So it is NS5B. All the others are NS5A and this sofosbuvir is NS5B inhibitor. Again, it is also a very nice drug to be used in hepatitis C and good seroconversion is seen after 3 months of use. So Computer Ji, can we have the percentage of students who have answered correctly? Answers, okay, 42% of you have answered it correctly, that is sofosbuvir. So there is slight confusion in others. They have some doubt. So no problem. Hepatitis C is also very common infection and as treatment is also available. So details should be known to all of us very correctly. so that we can treat the patient and the mechanism, the option, what all things we have. So we should be knowing that. So we can just go through the drugs available and the what mechanism through which they work. So
It
who
shows,
has
ma'am.
answered?
Yeah,
Yeah.
ma'am, please go ahead. Go ahead, ma'am.
Yeah. So who has answered it correctly, timely, actually? Madhurima Datta, I think you have answered it more than one time. That is excellent. And that too in 2 seconds. So excellent job, Dr. Madhurima. Okay. So now moving on to the next question.
I just
Congratulations.
wanted to say,
Yes.
ma'am, before we going to the next, that there was a fractured debate, like each one was 20-25 that in the previous question. Yes, ma'am. Next
Okay.
question. Next.
Which antibiotics below, antibiotic or antibiotics below have proven to be effective against gram-negative bacteria? Is it doxycycline? Is it vancomycin? Is it linezolid? Or all of the above are correct? So your time starts now. Your time starts now. Okay, so it is the time has stopped clicking. Can we have the correct answer first? Then we can discuss. Computer ji back. Okay, no issue. So Computer ji, can we have the correct answer?
Yeah. Yeah, ma'am. They are going to come with the right answer. And
Yeah.
meanwhile, even in this gram-negative infection itself is also a big problem these days, and the resistance and multi-resistance.
With every drugs, there are multi-resistant.
Yeah, exactly.
Yes.
I think Hardik's team, the question has gone away. We are not able to see the PPT. Can you start sharing the questions?
Okay, so the correct answer is doxycycline. We are back in the quiz. So correct answer is doxycycline. Other options were vancomycin, linezolid, and all of the above. So vancomycin and linezolid, these two cover gram-positive mainly, but doxycycline covers gram-positive as well as gram-negative, along with anaerobic and aerobic coverage. So that is why this doxycycline is the correct answer. It is effective against gram-negative. All of the above cannot be here because these two, vancomycin and linezolid, they are mainly effective against gram-positive. And this answer is doxycycline. It is a penicillin group of tetracycline group of antibiotic. So can we have the person answered correctly? Okay, so there was almost 46 and 41% have answered it A and D. So A was doxycycline and D was all of the above. So I have told you why D was not the option, because B and C were mainly covering gram-positive and not the gram-negative. But A, that is doxycycline, covers gram-positive, gram-negative, as well as aerobic and anaerobic coverage. So who has answered it correctly in a fraction of seconds? Let's see. Computer ji. Nitesh Badal in 6 seconds. So congratulations, Dr. Nitesh. You have answered the question correctly, because there was a slight confusion with many of the participants. Okay, so good. Moving on to the next question. So should we keep this question, Dr. Manjula? Gas gangrene, yeah?
Yeah.
Okay. Gas gangrene is most commonly caused by, it is actually Clostridium botulinum, Clostridium perfringens, Clostridium difficile, and all of the above. Your time starts now. I think it was an easy question for our participant as they have answered very tricky question very nicely. So can we have the correct answer, Computer Ji, first? And then we can proceed. Okay, so Clostridium perfringens. So we all know that this gas gangrene is caused by this Clostridium perfringens. It produces toxin that releases gas and can cause tissue death. So if tissue death is caused, gangrene is caused, it is not at all easy to treat. It is difficult condition to be tackled. And this gas gangrene is one of the life-threatening condition because treatment is again a difficult job once gangrene has set in. So before this, we have to be more vigilant in any trauma cases or in any other cases where we are suspecting that this gas gangrene can happen. So can we have the answer? Yeah.
Ma'am, before coming, what is your guess, ma'am? I feel all 100% would have answered
Yes,
it
yes,
correctly in this.
excellent. Bilkul. I also think that 100% have answered it this correct, and they should have answered this correctly. Yes, yes. So can we see the percentage? Still, there is some confusion. 2% have that other options also clicked that other option, but no problem. This is very basic. We have learned it in our MBBS actually curriculum, where we were talking or we have read about this gas gangrene. So we should be aware of, and it is a very common question. I think frequently asked question. So let us see who has answered this correctly in less than 2 seconds. Let's see. Shubham Chaudhary. Okay, no problem. 3 seconds, not 2, but yes, 3 seconds. So congratulations, Dr. Shubham. You have answered it correctly in 3 seconds. Okay, so moving on to the next question. Computer Ji, can we have the next question? So which prostaglandin is elevated in the pathogenesis of fever? Prostaglandin E2, prostaglandin D2, prostaglandin F2, or prostaglandin I2? Your time starts now. Okay, so your time has stopped. Again, a very common, very important question regarding fever. In the initial few questions also, we have seen about fever. We have answered it very nicely. But here also, pathogenesis is also very important when it comes to fever because it goes to, we have to go to our basics when we are talking about fever. Definition, pathogenesis, treatment, FUO, everything is very important. So I think this question also many of us has answered correctly. Can we have the correct answer, Computer Ji? Okay, so prostaglandin E2, it is elevated in cases of fever, and this prostaglandin rises the body temperature by coordinated increase in heat production and decrease in the heat loss. So this is how it works. Let's see how many of you have answered it correctly. It was one of a very easy question, I think. So, Computer Ji, can we have the percentage of students who have answered it correctly? So, when we are talking about quiz in fever quiz 2022, so fever should be known to each and every one of us. 80% have answered it correctly, good percentage, but still there are few who have opted other options. But prostaglandin E2 is the key this thing in pathogenesis of fever. So can we have who has done it correctly in time? Shubham Chaudhary. Again, you have done it good, Dr. Shubham, in 5 seconds. So very nice. So few of our participants are answering it very quickly in multiple times, means not only in single time, but more than one time. So it is very nice. Congratulations. Moving on to our last question, I think. Next question, please, Computer Ji. Next question. Yes. So for neutropenic FUO, nosocomial FUO and inpatient HIV associated FUO, the duration required to diagnose is 3 days, 3 weeks, 3 months, or 3 fortnights. Your time starts now. Okay, so your time is up. And can we request Computer G to show us the right answer? 3 days. So it is different. I hope you all have understood why it is different from that 3 weeks duration, because it is specifically for FUO of neutropenic origin, nosocomial FUO, and HIV associated FUO. So for normal FUO, what we have in the initial questions, it was 3 weeks. Workup should be of 3 weeks. It can be up to 3 weeks. But if we are dealing with neutropenic FUO, nosocomial FUO, or HIV associated FUO, then the diagnosis, if it is uncertain for more than 3 days, then we call it as FUO. And it is influenced by multiple factors like in HIV, CD4 count, other like geographical setting or local preferences, or any other infection which is set in locally. So this 3 days is the correct answer. So Computer G, can we have the percentage? 51% have answered it 3 weeks. So I told you why that confusion was there, because that was for overall PO, what we are talking about. But this was specific for neutropenic, nosocomial, as well as HIV associated FUO. Again, this FUO is very important topic, and we should be going through it once if we have any confusion, any doubt, because FUO, now we are getting many FUO, many cases of fever of unknown origin, because it take a good amount of time to diagnose it, to reach to a correct diagnosis. So Computer G, can we have the participant who have answered it correctly in fraction of seconds? Nitesh Badal in 3 seconds. Excellent. So many of us are knowing that this 3 days is also very important when we are dealing with a subgroup of FUO. So congratulations, Dr. Nitesh. You have done a good job. So now I think we have completed the 20 questions we were planned for. So Dr. Manjula and Dr. Yes, so I hand over it to Fever Foundation. We can have the Dr. Manjula, what?
Ma'am, thank you.
Yeah.
See, the computer, they are kind of doing the analysis at the back
Okay.
end.
Yes,
So
yes.
we may have to have a tiebreaker round, as I'm seeing.
Okay.
So there were multiple people.
Okay.
As I see, maybe one clear win, but we actually have to get 2 winners, as we have mentioned.
Okay.
2
Yes.
people will go as a team to Bangalore to compete in
Yes.
the national event.
Yeah.
So as we saw, I think we can guess there is first position, I think already we were seeing, but there is a definitely let the computer work, and then though we all know there will be a tie for the second, they're going to announce it. And once the people who are having equal score, second in position,
Yes.
they'll have to play the tiebreaker round, 3 questions. So you people can decide who is winner in
Yes.
that round. So along with the first one and the second one will go into the right. That's what it is. Is it okay?
Yeah, perfect. It is okay.
Yeah.
Right, sir. So
Yes.
can we have our IT team? Can we have, if you are ready with the winners, can we have, or if you're taking time, I'm going to show the other activity which we are going to play. We are going to conduct now. So let the computer, our IT team at the back end are working, and we'll tell in a minute or so. Meanwhile, I would like to inform all the participants here, like last year, this year also, we are going to have Fever Foundation case presentation competition for postgraduate student. So we are going to open the registration for case presentation competition. So can I have that slide, please, when they're working on the back end? So the rules remain the same as before. Many of you have actually worked, have competed in this field also. We got good response last year. So an interesting case or research-based cases can be given, but all the cases should be related to fever only. So there will be a link sent to you to all your registered members. So they're going to again, it will have a template in which it is only online format only, PPT format only, no hard copies will be allowed. And even the photograph of the hard copies are not allowed. It has to be presented in one slide format. The format will be sent to you in a registered email which you have given. You just have to upload that slide. And the last date, we are going to open the link by Friday onwards. So Saturday onwards, you can start uploading your interesting case. And the last date for that is 16th of October is the last date for competition. So if our IT team is available there, can you just show me the poster so people can see by the time you analyze, or if you are ready, you can give us the results. Both ways we are okay. Then I can talk about the fever case presented competition.
Ma'am, shall I share the poster?
Yes. Yeah, please go ahead, share the
Yeah.
poster. Right. Yeah. So I was mentioning about the case present competition for which, can you make it little bigger? Yeah, that's fine. So we are going to have this FEFCON Fever Foundation conference on 5th and 6th November. It will be in Bangalore. So winner of this quiz competition, 2 people will work as a team and they will be called to Bangalore and they will be competing in the national. So meanwhile, we are having a online fever case presentation competition. It will be an online event, and because FEFCON will be a hybrid kind of a conference, so we will have some people physically present in Baker, and most of the people will be watching through the online platform. And our scientific committee are inviting all the doctors, postgraduates, or even the practicing clinician for an opportunity to exchange and share their experience in various aspects of fever management in our conference. So the registration is open and the last date for registration is 16th October 2022. And as I've mentioned, your posters should be composed of 16:9 ratio. That's a widescreen type of the poster using PPT, and the layout is given in the link. If you can download the template for you to upload, and your poster should be consisting of only one slide. So sample picture is shown below, and the guideline and PPT implement, all these template can be downloadable from the link which you're going to share now. So what I have mentioning that, next slide. Yeah. So I was mentioning these are the guidelines for virtual poster presentation. We only accept electronic poster, that is e-poster in PPT or PowerPoint format only. Printed posters or photograph of printed poster not acceptable. Okay, so topic should be related to fever only. It can be research based or it can be case based, and category you can choose from the drop down button while you're uploading, whether you're uploading as a case study or an original research paper. Only the first author will be allowed to present the paper. Our poster committee will be screening through all your entries, and they're going to select top 10 people, and in that the first author will be allowed to make the presentation to the committee, and the committee will decide on the winners of this. And also, apart from the poster you present, you need to ensure that the title should not be more than the 15 words. And along with that, you need to actually submit a summary in a Word format, which has to be minimum of 500, maximum of 500 words. And the format for you is, it has to be in the JAPI format, our official Journal of Association of Physicians of India. That format in 500 words, you should submit the summary. And all the posters which have been accepted will be available on the virtual platform in a dedicated poster hall for everyone to view. So if you have any doubts, any clarification, please mail to us at feverfoundation@gmail.com. So we'll be more than happy to give all the clarifications. So wishing you all the best, and may the best participant win the quiz. I think quiz is not yet over. I'm just waiting for the result. So please be ready for the tiebreaker, I think. So I think our team is working. They're just telling me that they're going to announce now. And definitely, Madam, our quiz master and the judge are requesting you to be ready for the. So our computer judge is telling, can
And she has actually answered multiple questions. We have seen that very quickly she has answered, and excellent. I think you have read the topic in depth. So that is required for each and everyone. And like everyone has participated, that is also good. So this is the first winner. So congratulations once again. And you will be going to Bengaluru, right, Dr. Manjula?
Yes, ma'am.
Yeah. So
That will be the second winner of this from the East Zone. Is it right, ma'am? Dr. Manjula?
Yes, sir. Sir, please tell them only these questions for only these 4 people only can compete. Nobody else need to answer. So it's only tiebreaker for these 4 people only.
Yeah. So as Dr. Manjula has said, now this tiebreaker will be for these 3 competitors. All others are requested for these 4 competitors. All others are requested, please do not answer the questions which will be on your screen. So the 4 competitors, Dr. Tanvi, Dr. Kingshuk, Dr. Shubham, and Dr. Nitesh. So all of you, all the best. And can we start with the tiebreaker, ma'am?
Yeah. If yes, sir.
Congratulations and best wishes. Yes.
Yeah, best wishes.
Best wishes.
Computer ji.
Sir, there is a yeah.
Just a minute. Computer.
Yeah, we'll have 3 questions. Let's see, sir. We will have first 3 questions according to our judges. And then since we have announced, then after that also, if there is a tie break, as it has been already decided in the rules, that we'll type 1 question and the person who answers correctly will be the winner. Now we'll have 3 questions. After that, let's see, we may get a clear winner. Otherwise, as per our already laid down rules, that we will be telling the 4th question, and whoever answers that question after the second tiebreaker, fastest will be the winner. That's how we have framed the rules, sir. So you can go for the 3 questions. Yes, sir.
So let us start the tiebreaker. Computer ji, question number 1. So the question number 1 for the tiebreaker is, which of the following is not seen in a case of HLH, hemophagocytic lymphocytosis? A, hypertriglyceridemia, B, hyperferritinemia, C, hyperfibrogenemia, and D, hypofibrogenemia. So your time starts now. The time is over. Again, a very important and topic, hemophagocytic lymphohistiocytosis, where there is a problem in diagnosing the patient when the patient runs for like a PUO, as Dr. Shubha Lakshmi told, and we are not with the diagnosis. Then we go for the specific investigations like triglyceride levels and ferritin levels and fibrinogen levels, and probably a blend of all of these will help you in diagnosing whether the patient has HLH or do not have HLH. So can we have the correct answer first? So computer ji, can we have the correct answer? So I think there is some problem with the screen. So the correct answer is hyperfibrogenemia. So of course the D choice is self-explanatory. If hyperfibrogenemia is not seen in cases of HLH. If you do a triglyceride level, you will find something level of more than 500. You will see in a patient who does not have any symptom, who is running from fever and raised ferritin level along with low fibrinogen level. So there you start suspecting a patient of PU having HLH, and these patients generally do have a poor prognosis, and early treatment will help them, maybe sometimes in the form of steroids. So can we see computer G, who amongst these four candidates was the fastest? So 66%. So how are we going to 66%? Okay, out of these four candidates, 66% have answered it correctly, and 33% haven't. So it seems that 3 out of 4. So again, amongst these three, ma'am, let us see who is the fastest one. Dr. Shubham Chaudhary has been able to answer this question correctly in 5 seconds. Okay, so congratulations, Dr. Shubham. You have been fast enough to answer this question correctly. So probably Bangalore is calling. Yes. Yes, ma'am. So can we have the next question? So desert rheumatism is a term which is used for A, Behçet's disease, familial Mediterranean fever, C, coccidiomycosis, D, African trypanosomiasis. And your time starts now. So time is over. Fascinating term, desert rheumatism, probably fascinating and confusing enough to confuse many of us, that probably it's something like some sort of a connective tissue disorder. But now let us see what is the correct answer first. Coccidiomycosis. So it has probably very little to do with the rheumatism, as the name suggests, also known as valley fever, and it's an extremely rare disease where the fungus is found in the soil, and the initial diagnosis is often difficult by the symptoms. The symptoms may be non-specific like fever, cough, and say chills. And again, the name itself is not very, very informative as far as the disease is concerned. So are there any can we have the breakup first? Let us see how many people are really reading tropical medicine. So amongst the 4 candidates, so 87% have been able to answer this. Okay, so probably it's very, very interesting to know. And of course, if you are reading it so nicely, coccidiomycosis, desert rheumatism, Manson is a book where probably you will find some mention about this disease. So again, I think 12%. So maybe one candidate is not able to answer. And who is the fastest one who is able to answer this question? Computer Ji, who is the winner of this question? Dr. Tanvi Yusuf. She took a lot of time, probably 7 seconds, but then she is the lucky one who has been able to answer this question. Congratulations, Dr. Tanvi, for answering this question.
So the
Yeah,
last
Dr. Shubhalakshmi.
question now is going to decide. Let's see. Maybe second tiebreaker. Let's see.
Yeah, it seems, ma'am. Yeah, it is running really very close.
Yeah. Right. I
So,
think
Dr.
I'm very
Shubhalakshmi, you
happy.
throw this
Yeah,
question.
happy to say people are
Okay.
so well prepared, high competition.
Yes.
Okay, so moving on to the next question. Computer ji, can we have the next question? It is also not appearing very
Third
easy,
question.
but Banvard syndrome is caused by Borrelia burgdorferi coxel. I am not able to view properly. Yeah, Coxilia burnetii, Bartonella hanselia, and Chlamydia trachomatis. Your time starts now. So time is over, and this term actually is not very simple, or it is not very commonly used or commonly heard. But still, we have, because it is a tiebreaker, we should be having something like this only. So let's see what is the correct answer, Computer ji. Okay, so it is Borrelia burgdorferi. So what is it actually? What this syndrome is actually? It is a constellation of painful radiculoneuritis characterized by severe pain and burning sensation. So it is nerve involvement is there basically in this syndrome, and this organism causes this dermatomal pain, which is this Banvard syndrome, where there is severe burning type of pain, radiculoneuropathy is seen, and the patient is having dermatomal pain. It affects usually the limbs of the patient. So dermatomes of the limbs are involved mainly, and it is very not very common disease. Sacral involvement is also seen, sacral radiculitis, leading to this type of pain, and sometimes neurogenic urinary dysfunction is also seen in this Banvard syndrome, which is caused by this Borrelia. So let's see how many of V4 has answered it correctly. Computer ji, can we have the percentage? Okay, so this term was confusing. Answer is also very confusing. So 45 is still 45. That means I think 2 of us has answered it correctly, and 2 have still some confusion. I'm not very much with this percentage. I don't know how it has been this thing, but yes. So Computer ji, can we know who has answered it timely? So Dr. Kar has answered it in 10 seconds. So confusing topic, confusing answer, and took a bit longer time than usual, as per our previous records in this quiz only. So Dr. Kar, you have done a good job, but Dr. Manjula, I think, can we have the result?
Ma'am, I think again one more tiebreaker we can see again. So what we need to do is that you were going to ask one question now, and as it has been already laid down, whoever answers it fast correctly will be the second place winner.
Okay.
That's how it. No?
Okay.
Okay. So let them come out with that. So we have seen 3 people winning these 3 questions. So we don't have a clear second high competitions here, and
But
so
that time will not matter, because one has answered in 5 seconds and 10 seconds and something like that. Will that time will not matter?
no, that each
Okay.
questions we are going, and then who
Okay.
has together. So that so what has been laid down is that only. Now
Okay.
we are going to go with the last question. And
Yes.
then whoever wins, and even if it is there, then we are going to calculate the time.
Okay.
Competition
Yeah.
between Dr. Tanvi, Dr. Shubham, and Dr. Khan.
So now only 3 people are going to, out of 4, 3 people will
Yes.
be going to compete
Yes.
now.
Yes.
So
Okay.
you will be asking the one question, whoever answers it right, fastest,
Okay.
whoever answers it right. And if there are multiple people who answers it right, then the fastest among them will be
Okay.
taken as the
Okay.
right answer.
Okay. So first you will be telling the result of this 3 question, right?
Yes.
Then we will
Yes.
proceed.
Yes.
Okay. Okay.
Yes, ma'am.
Okay.
Very competitive, Dr. Manjula.
Yes,
The
sir.
quiz is the quiz is very competitive, very interesting. I think the students must be enjoying this process. Yeah, so the results are here. The second
Yes.
winner of each zone, it's again a tie, as told by Dr. Manjula. Now, Dr. Tanvi, Dr. Kingshuk, and Dr. Shubham. So we have got 3 competitors for the second tie, and the rules are very clear that now one out of you all 3 lucky people will be selected, and you have to answer it correctly. And if you all 3 or out of you any of number of you become lucky, then the fastest one will be chosen, and he will fly to Bangalore, ma'am.
Yeah.
Yes.
Yeah,
So,
correct.
right. So, should we
Okay.
proceed, ma'am?
So
Yes, ma'am. Yes, is our IT team ready? Can we show the next? So again, as our quiz master has already told, Dr. Tanveer Yusuf, Dr. Kingshuk, and Dr. Shubham will be playing this last question. Only one question will be asked. Whoever answers it rightly, fastest. If all 3 of you answer it rightly, who has answered fast will be taken as the winner. So I think you can.
So,
Sir,
we can
you will
have
be
the question
asking?
on the screen.
Acha.
Yeah,
Okay.
okay.
Yes, sir.
Yeah, tiebreaker.
The schedule of post-exposure intradermal rabies vaccination approved and in use in India is, your choice is 2222, choice B 202222, choice C 2222 and 0, and choice D is 22202. So your time starts now. So the time is up. Rabies vaccine. Okay. So again, the topic is very important. These days it is very difficult to walk on the roads because of the dogs. But again, the pre-exposure prophylaxis and the post-exposure prophylaxis, both as a postgraduate and as a patient, it's very important to know about it. And previously also there was a question in this quiz that if there is a dog bite, then depending on the category of the exposure, you will need to have that particular level of protection. Say if there is a oozing of blood or the category 3 is there, then of course vaccination should be supplemented with immunoglobulins. So now let us have the answer first, and then we will discuss it. So the correct answer is 22202. So again, a tricky question. The students can confuse themselves in this number game, but the correct answer will be that the schedule of post-exposure intradermal rabies vaccination approved and in use in India is that on 2220, the 1 dose is missed, and it's a 4-dose schedule. So if we have the
2.1 ml. Sir, this was given, usually IM was given then intradermal because the less amount of usage of the vaccine. So 0.1 ml and 2 sites are given. That's been approved. A lot of studies have been done in India. So they realize giving this dose also you get the proper immunogenic response. So that's why this dose has been. So we hope and wish that we have a clear winner, sir, in second. So whoever is answered, all of you might have answered correctly. but the judges will decide who answered it fast rightly will be the winner. And before the answer, I want to tell whoever is the winner will go with the winner, first winner. Both of you will be as a team playing in the national level. So you will become representing the Eastern Zone. We will be sharing each of you the contact details so you can discuss, you can prepare yourself, and then come as a team. So you will be competing the Eastern Zone representative. So not as an individual in the finals, you will be as a Eastern Zone team, you will be competing in the final. So both of you will be coming to Bangalore as a team. So if our IT team is ready with the answers, can we have the percentage and the
So it's again a bifurcated
one.
answer.
Yes,
So
yes.
yes, so one
One
will
is
be, I
correct,
think,
yes,
selected
correct.
amongst this.
I think we should get a winner by looking
Yes.
at the graph. Yeah,
Yes.
it
Yes,
should
ma'am.
one winner has to be
Yes.
there. Oh,
Okay,
Tanvir, you
excellent.
Dr. Tanvi, yourself. Congratulations, Dr. Tanvi.
Congratulations.
So it again took a lot of time for her, 12 seconds,
Yes.
but we have got the winner, ma'am.
Yeah.
Yes.
So can we repeat? Can we show us IT team the two winners' names so that in the final slide, the two winners who have won the Eastern Zone competition. I think judges, you can agree with me that it was fantastic and there was a lot of preparation went and the students came well prepared. And we
Yes.
should also thank the teachers. They have also training them very well. So lots of questions and then so much answers were also, most of them used to be right. Majority of the answers were right to be. So when they're compiling, you can give your views. Gansham sir, you can also tell your our supreme judge sitting there. So how did you find? So preparation was good. People were actually right, sir. Pankte sir, your opinion on the quiz when it is compilation is going on.
Yes, ma'am. I think it was very competitive, nail biting, and two tiebreaker were there. And I am audible.
Yes, sir. You're very clearly audible, sir.
Yeah, and I think, ma'am, I'm not very sure it will. We'll have an annual event in the November, and maybe there we can involve them also, and we can keep them on backup. Maybe because of some reason, the first and second participant may not come, so they can be on
Yes.
roll.
Yes,
And
sir.
second thing is because four of them were second position, we can give them at least some prize, some consolation. I will request the Fever Foundation team to just consider those
Yes.
three people who just missed by a double tiebreaker.
Yes, sir. We'll
Yes, sir.
definitely consider.
It was great.
Yes, sir.
It was great and a very difficult quiz, especially by Dr. Ramesh and Dr. Subbalakshmi. I congratulate both of them, as well as Computer Ji. I
Yes,
think the questions were very, very difficult. Even I am not knowing at least maybe 10-15% of the questions. Over to you, ma'am.
Thank you. Thank you very much, sir. Dr. Muruganathan, sir. Sorry, sir. Yeah, right. So I think we are just waiting the final slide showing us the results. Yeah. Yeah.
Congratulations to both of the winner, Dr. Madhurima and Dr. Tanvi. Excellent. You both have won this East Zone Fever Quiz 2022. So we will be seeing you in Bangalore in November, I think.
Yes, ma'am, in November.
Yeah.
So Dr. Madhurima is from Center Medical College and Dr. Tanvi is from Assam Medical College and Hospital. Congratulations to both of you.
Great.
So
Assam
yeah,
has come up. Yeah.
yeah, congrats. And both of you, we will be sharing each other's contact details. Please prepare as a good team and win the trophy for your zone. Congratulations to both of you. Dr. Amit sir, closing remarks.
Many congratulations to the winners as well as Fever Foundation for organizing this such a nice and competitive quiz where the tiebreakers have gone into the second stage from 1 to 2, and even we were worried that with such a good students who are working and learning so hard, that how we are going to decide between 1, 2, and 3. So probably it is just a mere chance that the students come at first and second. Of course, their efforts are there, but many congratulations to all those who couldn't come to this first position, but they all are equally competitive and equally good as far as their knowledge and their quickness is concerned, ma'am. So as Dr. Ghanshyam has said, probably they may be rewarded with some consolation if the Fever Foundation thinks so, ma'am. Yes, ma'am. Over to you, ma'am.
We'll go as per advisor. So with the permission of all the judges and the quiz master, can we close this event and then complete, and then what do you say? Can we close the event, sir?
Sure. Yes, ma'am. Sure, ma'am.
Yes, sure.
Please,
Thank
ma'am.
you very much. Thanks for all the participants, and congratulations, the winner. And winning is not, we all know that participation
Yes.
is also very, very important. So all the best to all of you. Thank you so much. Thank you, our judges and the juries, and thanks
Thank you,
everyone.
ma'am.
Thank you.
Thank you. Thank you, Dr. Ghanshyam. Thank you.
Thank you, everyone. Thank you, Dr.
Yeah,
Ramesh.
thank
for
you,
So
sir.
our IT team,
you.
can we stop live, and then we can stop the live recording.
Recording stopped.